Okay, so we've been dancing around this already in this lecture, but let's talk about kind of how do we understand health and the factors that determine health. So we're going to talk a little bit more objectively and directly about that. So when we think of a disease, right, there are things that are called contributory causes. So things that are risk factors for you developing that disease, right? So certain people are at higher risk of developing cancer than other people. Some people are at higher risk of heart disease than other people. So those are the contributory causes, for example. But then there are determinants, which are kind of the causes of the causes. So what are the things that make it more likely that you will have the things that increase your risk for the disease? So I know that sounds kind of abstract, so let's give some examples. So if, for example, you don't get some comprehensive sex education because of where you live usually, or the type of household or culture or religion in which you are raised, statistically, and it can vary by individuals, of course, but statistically as a whole, those folks are more likely to engage in unsafe or unprotected sex, and therefore they are also more likely to develop HIV. So using that example, right, so unsafe sex is what leads someone to develop HIV, but there are things further upstream that make it more or less likely that they'll engage in unsafe sex. Another example. If you have a lot of people around you who smoke, friends, parents, that cool kid that you want to hang out with in the high school, then you are more likely to become a smoker, which means you are much more likely to develop lung disease from smoking, which is called COPD, right? So as much as we like to think that we are the own masters of our fates, we are actually very influenced by the people and the environment around us. So those are those determinants of health. So we talked before about kind of your genes or your biology, your individual health behaviors, your access to medical care, and then your kind of social determinants before. What the textbook does is kind of takes that and expands it even further into this big GEMS approach to the determinants of health, which I like actually quite a bit. And they map pretty well onto kind of the big four that we talked about previously. So I've color coded them so you can kind of see. So for big, B is for behavior, the individual behaviors you choose to engage in, right? So that's kind of the red one. I is infection. Now, interestingly, your likelihood of encountering an infection is mostly due to the ecology of the place where you are, right? So as we saw in South Africa, there's a lot of HIV around. You're much more likely to get infected. So I coded that one purple. Genetics, of course, your genes, your biology, your age, your sex, those things are definitely a piece. And then your geography. So where do you live? I live in Wisconsin. I'm not going to get malaria, right? And that's not because I'm using a bed net or something or mosquito netting, or it's just because it's not here. I've already gotten Lyme disease, right? Because that's really common here. But for someone in Alabama, Lyme disease is not very common, right? So your geography is really important, not just in terms of your risk for certain infectious diseases, but also in terms of, I live in a place with really clean, clear air. I used to live in New York City. That was not the case there, right? So our geography has a huge impact. And then environment. So where geography ends and environment begins, I think is variable, but environment can mean anything from the quality of air that you breathe to the quality of the water that you drink and the infectious diseases that you may or may not come into contact with, but also, is your home well insulated and warm? Right? Is there radon in your home? Is there lead in your drinking water? Right? So that can be lots of different things. And then M, medical care. We've talked about that before. And then they have S, socioeconomic and cultural. So we know that people who have higher socioeconomic status in general tend to have better health status, in part because they have better access to resources, they're wealthier, they can afford nutritious foods and gym memberships and all those types of things. They're also educated and they know about what things can help protect their health. But then there are also cultural things, as we're actually even seeing in the United States right now. So, for example, people who tend to vote Republican are much less likely to be vaccinated against COVID. And people who vote very Republican as a group have a much higher rate of death from COVID because they are less likely to have been vaccinated. So, cultural beliefs, and which usually they weren't political things that influenced your decisions on healthcare. Usually it was just things like religion and culture. But yeah, all these things can have a huge impact. So the book does a really nice job of talking about the example of Jennifer, a person with asthma, and looking at how this big GEMS approach, all these different determinants influence her health and her outcome from her disease. So make sure you read that. All right. So I just want to counter a little bit. As Americans, we tend to get inundated with a lot of kind of pull yourself up by the bootstraps, individualist messaging, because that's kind of the way our culture tends to go, right? So a lot of these things you probably see on the regular. So you're responsible for your own health. You're completely responsible. It's all in your own hands, right? Only you can choose to be healthy or be sick, right? At the end of the day, your health is your responsibility. And while it is true that the individual behaviors that you choose to engage in or not, to the extent to which you can consciously choose them, is important. And while it's true that you can influence your own health for the better by the choices that you make in terms of the foods you eat, how much sleep you get, what substances you do or do not use, how much you move your body, all of those things are really important. They are just a piece, right? So those individual behaviors, that part that you can control, is only about 25% of what determines your overall health. So I just want us to keep this in perspective, right? And realize that, well, not entirely, right? There are things that you have impact and agency and control over at the individual level, but a lot of the things that determine your health are completely outside your scope of influence, right? They are beyond you. They are things that you do not have individual control over. So I just want to make sure you realize that. So if you get cancer someday, it's probably not your fault. Okay, it has to do with all these other things too, right? It's not just about the individual behaviors that you engage in. All right, so what can we do at the public health level, at the population health level, at the community level to help improve the health of all people? So, whoops, I made a mistake there. But so when we look at ways to approach the population, the health of a population, of course, we have our healthcare system. So our doctors and nurses and hospitals and clinics. And in terms of protecting our health and promoting our health, right? They're going to help with these preventative services. So, those childhood vaccinations and ongoing vaccinations that you get as part of routine visits to your doctor, behavioral counseling. So physicians and nurse practitioners and folks do a lot with people talking about promoting healthy eating and regular sleep and regular exercise, smoking cessation, helping people to curb their alcohol use and recognize when it's a problem, all those types of things. They also do disease screening, so things like mammography for breast cancer, pap smears for cervical cancer, colonoscopies for colon cancer screening. There are lots of different conditions that we can screen for, and if we detect them early, we can prevent them or cure them. And then preventative medications. So most of you are probably not of an age yet where you need to be on any preventative medications, but as we age, if we develop certain types of health problems like high blood pressure, for example, that can increase your risk for heart disease, and taking medicine to control your blood pressure can decrease your risk for heart disease. So those are kind of preventative medications. Some of you, if you grew up drinking well water as children, you may have taken fluoride tablets, and those are preventative medications to prevent you from developing cavities. On the traditional public health side, we've got control of communicable diseases, which you're really familiar with right now, the things that we do on a population level to try to control infections, but also environmental hazards. So looking at lead in the water, looking at the health of drinking water or contaminants in the soil, air pollution, all those types of things. And then food and drug safety, right? So not only is your food safe, but are the medicines that you take safe and proven to contain what they say they do and not cause harms that are out of proportion to their benefits. And then things that we can do to reduce risk factors. So wellness programs, education programs to help people choose healthier behaviors. And then on the social policy side of things, right, there's a ton that we can do there, right? So improving the built environment, which could be anything from ventilation controls on buildings to make sure people get enough fresh air, to making sure that there are lots of parks to allow for outdoor recreation in cities. Our bike trail around Lake Menominee is an excellent example of how the built environment can help foster and promote health. Social policies are also really important for education. So for example, in the state of Wisconsin, we do not require comprehensive sex ed in our schools. That does not mean that some schools don't teach it. They do, but some schools definitely do not. And so the education that young people get on how to prevent pregnancy and sexually transmitted diseases varies widely from community to community. That's social policy, right? And then, of course, nutrition in terms of school lunch or other nutrition and supplemental programs like food stamps or the Supplemental Nutrition Assistance Program, WIC, which is Women, Infant, and Children, supplemental nutrition program for young families. And then there are things that we can do through tax codes and tax credits and incentives to help address socioeconomic disparities. So this year, the additional child tax credit that many families received actually lifted half of the children in the United States who were in poverty out of poverty. So that had a huge impact on the health and well-being of those children and those families. And then the mobility of goods and populations, so making sure that trade can occur, that things can get to where they need to be. So lots of different approaches to improving the population's health, right? The health of the overall population. One of the last things that the chapter talks about is what our focus should be. And so there's kind of two different approaches, and depending on the condition, sometimes we'll use one approach or another, and sometimes we'll use a little bit of both. So on the left, we see this kind of high-risk approach. So focusing on those individuals who are at highest risk for a certain disease and condition and intervening there to kind of move them out of that high-risk category. An example of this would be needle exchange programs. So people who are IV drug users are at very high risk of getting HIV infection because it can be transmitted that way, as well as certain types of hepatitis. And those diseases can be fatal and cause lots of disability. And so targeted interventions for those high-risk individuals can include things like needle exchange programs where they can trade in their dirty needle and get a free one, free clean one, so that then they are less likely to get infected. So we don't offer that to everybody because most everybody doesn't need clean needles, right? So we're just focusing on a particular group that's at really high risk. That also happens to be what's called a harm reduction approach. Sometimes people are like, oh my gosh, then you're just encouraging them to inject drugs. And actually the data shows that it doesn't make them more or less likely to inject drugs. It just makes them less likely to get infected from using dirty needles, right? So it's a harm reduction approach. We can't fix everything, so we'll fix what we can. But anyway, we'll talk about that later probably. All right, and then the other approach is improving the average, right? Or shifting the mean, right? Trying to improve the overall, reduce the overall risk of everybody in the population by a little bit. So a good example of this would be putting fluoride in drinking water. Right? So fluoride helps protect against cavities. So putting fluoride into municipal drinking water systems helps reduce the risk of cavities for everyone, right? So we're not looking for who particularly is at high risk, we're just reducing the risk for everyone. Okay. So these are all the things that we've talked about in this lecture. So all the many ways that our lives are impacted by public health, the history of public health, and some amazing things that have happened through the years that allow us to have all of these tools at our disposals nowadays to improve the health of a population. Then I talked about differing health risks depending on where you're at in the life cycle, the things that you're at risk for, and how populations change over time, both in terms of their demographics and then that nutritional transition that often happens as a country moves from being kind of less developed or having fewer resources to then becoming more developed and a wealthier nation. And then we talked about, okay, well, what are the tools that we have to impact the health of a population? So there's the healthcare piece, the public health piece, and then those social interventions piece, which is a conglomeration of laws and policies and nonprofit organizations and all types of things. We talked about the determinants of health, and instead of just using that kind of four category pie chart, now we're kind of expanding that and talking about the big gems, and then that focus on versus just looking at the high risk folks versus looking at everyone and kind of shifting the population mean. All right, I hope that was helpful, and I will look forward to seeing you next time.